The views and opinions expressed on the following program are not necessarily those of the staff and management of Salem Media of Hawaii.
Aloha and welcome to Be Fit for Health. This is Bianca, your host. It's another great day to celebrate our health and wellness. And, it's crazy times we're living in. We're always thinking about our health. It seems everything that we do, turning on the TV, whether it's reading the newspaper or going on Facebook, seeing these news briefings constantly about, the latest updates on COVID. And, I know like you, I'm a bit tired of all of this, but it's reality for us right now. And, thank God we've got the vaccines out there for people who are very worried about their health and they don't want to catch this COVID-19. And I totally understand. There's things that we can do to control our health. And, and I've been talking about it all year about the things that you can do, whether that's sleep, making sure you get a good amount of sleep so that your immune system gets built up and you can recover and regenerate while you're sleeping. Nutrition, obviously eating whole foods, things like that. Taking supplements that are good for you, like vitamin D, zinc, vitamin C to a certain amount. We've talked about dosages before. So you can always revisit my YouTube channel, Be Fit for Health, and re-listen to those shows because those shows are, going to teach you, again, things that you may have missed, you'll catch the second time around. So it's really a good thing to go back and review some of the things that we've gone over the past year. So today we're really lucky. Again, I'm just really blessed to be around people that know a lot of smart people. I don't have all the answers. Thank God some of the people I'm bringing on do. So that's my job here, make sure that I bring on the right people for you guys to get the right information. So my first guest is from Adventist Health Castle, and she is a registered dietitian and she's a diabetes educator. She has been a registered dietitian now for about 20 years and has been certified as a diabetes educator for about 7 years at Adventist Health Castle. She graduated from Penn State University, and she actually had a really cool desire, which I hope she achieved, and I'll ask her when she comes on, is she had a desire to be a Pittsburgh Steelers dietitian, and she pursued her certification in specialist as in sports dietetics. I can't talk today. What's going on, Leah? My producer's laughing at me. Anywho's, she is incredible because she's actually worked in various places from Pennsylvania, North Carolina, Dubai, my goodness, Hawaii here, obviously. And we're lucky to have her here in Hawaii because she's obviously a wealth of knowledge when it comes to our nutrition and what we can do to also support, ailments that you might have, specifically to diabetes, because a lot of us here in Hawaii have diabetes and a lot of people still don't know proper nutrition. And that's key to keeping that sugar levels balanced. She's also worked in hospitals. She's got a lot of clinical experience. She's worked in food services. She's developed menus. She's done research. She's done school menu planning, which is fantastic because that's a big thing for me. I'm a big passion for making sure the kids eat well. And she's basically focused on outpatient nutrition and community wellness for diabetes. So she's on the board of all board nutrition fields, which I have worked in, she says. Is basically on how nutrition and food can change people's lives. I like that because that's been my biggest motto on the show. Nutrition is everything. And if you don't have that down, I don't know, man. That's how we live, right? All the nutrients that goes into our bodies, you can't get that from burgers and French fries and, junk. I'm sorry, Leah. You can't. I'm sorry. So here we go, guys. Welcome, Miss Amanda McFarland. Amanda, are you there?
Hi.
Hi.
Yes, this is Amanda. How are you?
Good. Welcome to the show, and I appreciate you taking the time because I know you're busy. And, I'm excited because getting your perspective and educating the audience is so exciting for me because I know what you're going to say is going to be so important to a lot of people.
Oh, well, thank you for having me.
Of course. So I know that, we're going through a lot of stuff this year. Stress doesn't help our bodies heal either, but putting in the wrong foods in our bodies causes stress too. And I know you're an educator, so give us a little bit of idea how crucial having the right balance of nutrition in our body is to our immune system and to, healing our body.
I think that's just such a hot topic. Everybody asks me now, what is something that I can do to help protect myself? And I think now, not like every time is necessary to be healthy and to live well, but I think even more importantly now, to think about how can we stay healthy, even if you did get, a disease or something, how can we handle that and live through it healthy? So my first recommendations for most people to strengthen their immune system, you've probably heard a lot about supplementation, and I'm always an advocate for food over supplements first.
Right.
But obviously the first thing I say is get outside and get some vitamin D. And then if you can't get your vitamin D from getting outside for whatever reason, then maybe talk to your doctor about supplementing with vitamin D. Zinc is another great supplement for your immune system, or vitamin C. But then there's also a lot of ways you can get that from your diet. So if your diet's not up to par, that's where I would talk to your doctor.
Yeah.
Another thing that I really focus on is what are you eating? In terms of color, a lot of people think that dietitians just want you to eat fruits and vegetables just because we know they're good for us. But, all those different colors of fruits and vegetables actually play a purpose in your body. They have polyphenols and antioxidants that help protect your body in case you do get sick and help your body handle that stress better. So every color offers a different benefit. But there are even colorless flavonols that are in food that, but a good place to start would be get a variety of color. Get 2 at breakfast, 2 different colors at lunch, get 2 different colors at dinner. And I'm not talking about a hamburger, fries, and ketchup.
And you paint those and then make it the right color?
Exactly.
That's what they'll try to do, I'm telling you. I know the audience. It's all good.
And then something that I'm really a big advocate for is just eating a variety of plants. Fruits, vegetables, and whole grains actually have a lot of good fibers that support a healthy gut. And something that we're really learning about our health, it starts in the gut with that bacteria that's present in our gut. And I'm actually in an open house that we're having on Thursday, January 21st, and on January 22nd. On Thursday, it's at 6 p.m., and on the 22nd, it's at 12:30. I'm doing a discussion on gut health and how to support that healthy gut and ways that you can change your diet to really help that bacteria thrive. And then, of course, last but not least is regular exercise. I feel like stress, you hit it in the head when you started, is stress just plays such havoc on our immune system and how we handle things. And so people don't recognize that exercise is important just to help your body manage stress, not just for overall health, right? And it plays a huge role in your immunity, your mental health, and your gut bacteria, we're learning.
Yeah, and it doesn't have to be stressful workout either. And we're talking 20 minutes every day or maybe 3 times a week. You just do something physical that will get your heart rate up.
Yep, just 10 minutes at a time can make a difference.
Yeah,
exactly. Just 10 minutes. But any minutes is better than no minutes. And a lot of people are like, I only have 10 minutes. It's not worth my time. A minute is worth your time.
Yeah. If you can get your heart rate up to a certain percentage, I would say at least 60% of your max heart rate, that will give you, because I'm a trainer by trade. So,
awesome.
So, I've been doing this for 30 years, and that's why I understand everything you just said is what I've been living by for 30 years and trying to get people to understand. Moving, especially if you have what I have fibromyalgia. So when you have a nerve disorder, which is overactive nervous system, you work out too much, you are shut down for a while because that's stress in the body. And so I always tell people, if you have some kind of condition, if you can just get the circulation going in your body so that we're able to get rid of the toxins and all the junk that's wasted in the system, then you're giving your body a chance to heal better. So that's kind of imperative. And then you put nutrients in the system, like you're talking about. That's golden. It's like you're halfway there. And then the other half, your doctor has to deal with. But, it's like you're doing your part. And I think that's the most important thing. And you're hitting everything correctly. Thank you for that.
Mm-hmm. So
I know that you have to deal with a lot of, not just regular people when it comes to their diet plans, but you're dealing with specific people with diabetes who are very susceptible to catching COVID based off of the fact that they are more open to catching probably anything, even catching a cold. So how do you help them with their program when it comes to especially this time?
As a diabetes educator, one of the things that we've always fought for is to be able to provide care through the phone or video or just connect people with a program. And, we want to make sure that they have equal access to all the vital information that they need to manage their diabetes long term and prevent those complications. So with medical coverage changes that are happening now during COVID, there's so many medical changes, we are actually able to provide medically covered appointments virtually or through the phone. And I really never thought that somebody could just dial into one of my diabetes classes, and now it's totally possible. And I'm really hoping that even beyond COVID that this becomes an option for people because they feel so much more comfortable being able to talk to a dietitian or attend a class from their actual home,
Yeah, and there's those test kits that people get at home, and then they have a Zoom meeting with a doctor that may be in California or it might be in New York. I mean, there are so much things that you guys can do now because of this technology. You can reach patients that maybe used to live here but moved to the mainland, and now you can still be their, practitioner or nutritionist still.
Yes, exactly.
Yeah.
And the virtual experience is just something that we're continuing to evolve and we're all adjusting to.
Oh, yeah. That's exciting times. Very exciting times. I know that with this COVID thing, how are you changing people's diet plans versus what they were, let's say, 2 years ago? Like, what are you adding in there? What are you taking out there? Or is it the same?
Honestly, it's really getting back to that, just looking at the colors and the healthy gut. I'm really focused on that gut bacteria this year. I mean, I am every year, but I mean, the more and more that we research and that we know that so much starts there with that bacteria, I think I really probably overemphasize creating a healthy gut more than normal, and I'm definitely going to be doing a talk on that at our open house. Other things that have kind of changed in our careers doing things virtually is that now I can be in somebody's kitchen, and I can assist them with menu development, and we do label reading together and cooking together, and then I get to see what their food and social issues at home, because you usually have a family member in the background saying, no, that's not right, versus in person. Maybe I'm getting a different situation, but I get to see how they live.
I just had a mental visual thing about you popping up out of nowhere on the camera of the laptop going, hey, drop that cookie.
What are you doing? Exactly.
Drop that cookie right now.
It's like having a personal dietitian 24/7,
like, God, is that you? No, it's Amanda.
My patients feel uncomfortable when I see them in a grocery store sometime. You should see them, like I'm the food police or something. No, that's not what my job is. I love food. I didn't get into my job because I didn't love food, and I love all kinds of foods. It's a matter of how if we know that something is not as healthy for us, how are we going to make up for it?
Right.
In our diet.
Right.
Like, what are we going to do 10 times more because maybe we like this certain type of food that we know that's not very healthy for us?
Well, it's crazy to think, like for me, I've done food allergy tests before, and and gluten never really popped up, nor did I really test for it specifically, but I do feel like I'm gluten sensitive because of what my sensitive system now that I have. So I sometimes eat gluten. I mean, how can you not? It's so delicious, right?
But then you feel the inflammation.
Oh my gosh!
Immediately.
Yeah, and I just did a test recently on with a doctor from the mainland because we were talking about how great technology is, and it showed that I had inflammation on the membrane of my cells, which makes sense because of oxidative stress at a higher level than most. So if you think of in terms of if your cells can't get rid of the free radical damage as fast as it should, you have toxic load in your system. Even if you eat well, sometimes your body can't simulate the good stuff in your body. Even if you have bacterium that's there in your gut, you got to figure out which bacterium you need more of just in case to combat some of those free radical damages.
And it's your level of inflammation. Like everybody's so different in terms of, something that might throw somebody's inflammatory response off for you, it's just really escalated. So then you have to look at, I'm telling people I can't get rid of inflammation, but I can maybe help your body deal with the inflammation a little bit better by maybe figuring out, is there something that you're doing in your diet that could be contributing even more that's just setting you over the edge?
Yeah, it's really a matter of having people know what questions to ask, though. And that's why I like having people like you on my show, because if you can teach the audience that when they go see someone like a medical professional, what are the right questions to ask? Like, if they want to get into a healthy regimen to balance out, let's say they have gout or they have, joint pain, arthritis, what have you, and they're in constant pain, inflammation pain, what types of food would automatically help them with reducing some inflammation?
Yeah, and their doctor will probably send you to a dietitian.
Right, and which they should. But not every doctor has a registered dietitian in their pocket that they...
I know.
You know what I mean?
I know.
So,
and it's really working with the patients. What I love about my job is everybody's so different that I get to work with them as individuals. So we kind of work together and figure out those particular issues, those exactly what you're saying, what foods are going to work for this person versus somebody else, and what triggers and what doesn't. And, sometimes it takes time. I'm not a rocket scientist, but sometimes food is not always easy. It's figuring out what's going to work well with you. Some people, they immediately feel different and feel a change when they look at their diet. And then some people, it's just going to take time. And you have to be patient with yourself.
Yeah, it's really crazy. I was going to say too, with everything that's going on with COVID, besides COVID, there are a lot of people who are laid off and they need help. Are you covered by insurance as a registered dietitian? Because I don't know, is it medical?
Absolutely. So
Nice.
I do all outpatient nutrition counseling.
Okay.
And we're all virtual right now, and we're providing, I do medical nutrition therapy for medical conditions like high blood pressure or high cholesterol, digestive issues, diabetes, weight management, or food sensitivities or allergies. And a lot of those conditions are covered by your insurance. Not everybody's is, though. So I do offer a group class that can sometimes be a little bit cheaper, that I cover different aspects of each of those conditions.
Sure.
To help people in the process. So we do have a self-pay option. We do take insurance. And then we also have most diabetes diagnosis is covered to see me either as a dietitian or as a diabetes educator, because I wear the two hats. So we have our diabetes self-management education program that's it's a 5-class series. It's 2 hours long. I know it seems long, but virtually now it goes by so fast. I tell my clients, I'm like, how did we just spend the last 2 hours? And they just want more. They want to stay on longer. So that excites me when people are actually interested and engaged and they want to be involved in the program. And our program's a little different because we spend 2 hours just on diet, where most diabetes programs only spend about 20 minutes.
Right.
And then I like to follow up with my patients, and now we have access to follow up with them as much as we need to, which is also usually covered by their insurance. But basically, every time they get an A1C test done, I try to track them and help them track their numbers or their diet changes, or maybe they fell off track, they want to get back on, So we do that here at Castle. Other things that we do is like community outreach. We're really focused this year on building relationships with our community partners and really looking at our community as a whole and assessing what does our community need from a nutrition perspective. So we are also doing that here.
Yeah, there's a lot of small clinics, and there's a lot of little health provided arenas, I guess you could say, that try to direct themselves towards diabetes. There's a foundation for diabetes here, right? I think there's a couple.
Yes,
for
absolutely.
Awareness. I appreciate that, because I think a lot of people here, we've got the Hawaiian culture diet here, and that's not necessarily completely bad, but it's not really, I don't want to insult anybody, but at the same time, there's stuff in there that we don't need to be consuming.
There's certain things that shouldn't go together in the same plate.
Yeah, Mac Salad, as great as that guy is, I got to tell you, I was just talking to another guest of mine that You know, what killed me is I had brought on 2 individuals that lost collectively 190 pounds. And
Wow.
within a year's time, which is about right. If you're that big, you tend to lose weight faster initially, and then you are stuck at the last 20, 25 pounds to take out. But they were saying to me that, they would, their mythology and everything was great and everything, but it's like they really didn't have the education support that they needed. One went on a program app to help her with, how to portionize their foods. But when it comes to understanding what's out there to eat, there's sugar in everything.
Everything.
There's sugar in the proteins. There's sugar in those mac salads. There's sugar in the sauces. It's like the way that the culture is here in America is that the more sugar that's in foods, the more addictive you become. And
it's so true. And my husband and I have been off of sugar in our house now for over 2 months, where no added sugars of any kind come into the food.
Nice.
And I've just requested that I make Christmas cookies.
Ooh. You could do that sugar-free. My brother made pumpkin pie without sugar. He made it with more of the keto level. But he just put those like a stevia type sweetener,
an artificial sweetener.
Yeah, and he made ice cream, caramelized made ice cream with the same keto type idea.
But I'm going to do it without any chemicals. So I'm just going straight on, just using applesauce. I'll let you know if they turn out okay. But
yeah, but applesauce is good too, though. It's natural sugar. It's good for you. It's
natural, yep. So
more
digestive. Natural, the better. And that's kind of our motto at home right now is just like, why are there so many additives in everything that we consume? So I haven't made the cookies yet, and Christmas is around the corner, so we'll see how it goes.
Oh, you got 2 days, girl.
I know.
You better hurry. And I'll give you my address before we go so that you can send some over to me, okay?
Okay, there you go.
I'm okay with eating no sugar stuff, but maybe not the rest of the audience in the island. I don't know. So give us a little bit on, again, your update. You're going to have an open house on January 22nd, and the 21st and the 22nd. And that's going to be at 6 p.m.
Yeah, so it's our wellness series. It's a new wellness series that we're doing this year. It's called Living Well Through COVID to get motivated in 2021. So I recommend all your listeners come. The open house is free, and it's being offered at 6 p.m. on Thursday, January 21st, and at 12:30 p.m. Friday, January 22nd. I'm not sure if I can give the details now. Did you need the details over of how to get registered?
Yes, please.
So it's at AdventistHealthCastle.org /wellness for registration for registration details. And then we're having lots of other things in our open house. We're going to do art, we're going to do cooking, coping, fitness, a CHIP program, which is offered by a cardiologist. We're going to have myself. I'm doing a segment on Mind Your Gut. So our website, you can register on Vagaro.com, Adventist Health Castle, and it will be listed under there.
Okay. So Vagaro's VAGARO.com /Adventist Health Castle /classes.
That's correct.
Okay.
Thank you.
I just want to make sure I got the thing out there. So I think we're running out of time with you because I'm going to bring on your partner in crime in the next segment.
Absolutely.
But I want to say, I'm really excited to know you exist. It's a pleasure to have met you through this channel here. But I definitely may reach out to you in the near future just to partner up at some point because I, as a trainer, have a lot of people that I would love to send to when it comes to having someone who's as educated as you are and helping them specifically with their program. And I may even come to you and become a client because, like I said, I know a lot about nutrition because that's what I've studied for a very long time. But you know what? You deal with things that are very specific that I have a lot to learn about. So I'm really excited to.
Oh, I appreciate that.
Be a partner
Absolutely.
with you.
And I'm a sports dietitian by trade, too. And
there you go.
I don't know if anymore, but I used to be the only one in the state of Hawaii. So.
No, that's fabulous. Look, and I know you. So, hey, that's awesome. Well, I appreciate you, Amanda, for coming on. And I will look forward to our future relationship in the near future, and we'll definitely get together again.
And hopefully we can continue to create and evolve and adjust to ensure we can bring healthy lifestyles to our whole community.
And back to normal, hopefully sooner than later, right?
I know.
Well, God bless you. Thank you so very much.
Right.
And
Thank you very much.
You have a good rest of your day. Guys, we're gonna take a quick break, and when we come back, we're gonna be with her partner in crime, Tracie Ann Tjapkess, I think is the way we pronounce it. I'll make sure. Thanks, guys.
You don't need to be a member of a gym to get your health and fitness back on track. Be Fit for You with a Be Fit for Health online personal training and nutrition program. With 30 years of personal training experience, Bianca will help you better yourself and be fit for health. For more information or to schedule a free wellness consultation, visit BeFit4Health.com for more.
And we're back. All right, guys, this is another great day to celebrate our health and wellness. Like I said before, we've been talking to Adventist Health Castle. Try saying that a couple of times. And these guys in this clinic and wellness center, these guys are amazing, very brilliant. I just got through talking with Amanda McFarland, and we talked about nutrition. We talked about things that you can do to get your body back into balance. And it's really imperative. I mean, like I said, all year round, nutrition is everything when it comes to getting your body what it needs to do what it needs to do. And our bodies are very resilient, and it can regenerate and recover if you give it what it needs to do its job. So I'm rambling here, but I want to get into my next guest because I'm actually really excited. And that's why I'm talking a mile a minute, because Tracie Ann Tjapkess is one of the most leading influential people at Castle. And she is with Adventist Health Castle like Amanda, and she's basically there to help coach you and guide you when it comes to your health and well-being. So she's been in this profession for about 25 years, and she has been a healthcare administrator in hospitals, in clinics. She's helped with health plans. She's worked to evolve traditional healthcare to the population, and she's also actually helped people, reteach them with new habits, helping them with better habits. She's also supported organizations and communities in the United States, Mexico, and then she's come back to Hawaii. She's brought back her skills and knowledge to help us here. Thank you so much, Tracie. Are you on?
I am. Thank you, Bianca.
Well, I know I kind of started rambling in the beginning. I got really nervous and excited to have you on. I'm reading your stats and going, wow, this gal is great. I can't wait to start picking your brain. So get ready.
Oh, that's so funny. I thought it was my job to be nervous, and you assuring me this is going to be an easy sleigh ride across.
Don't worry. I'll only ask you, physics questions and, mathematical questions that you need to work out before, you end the show here. So just get ready for your...
Sounds fair. Sounds fair. If you ask me any statistical p-values, I may stutter, but I'll try to pull one out of the hat.
Well, there you go. No worries. Got it. So tell me a little bit about what you're doing with Adventist Health Castle.
Oh, thanks for asking. So the team here, what we're looking at is how do we reach people, especially during COVID, to help people connect. I love what Dr. Vivek Murthy, our former and upcoming Surgeon General, has brought to us. He points out, it is a human right for people to connect.
Yeah.
And so that is what we think about. How do we show up so that people can connect to resources and skills to make healthy living a reality? So that's what we're all about.
Well, that's great. I'm already in. So let's let's get going. So what are some of the challenges you're facing right now with this sudden change in the way that we do business? I mean, it's been about 9 months or 10 months. What are you guys doing that's different this year?
That's a great question. It's always been, I think even more so for people in Hawaii, a challenge as we live in the price of paradise. People work really hard to be able to live in paradise. Yeah. So you couple that with everything's getting tilted upside down, right? The people we normally connect with, the habits we normally have has changed. Right. So it's been a rethinking of how are people able to connect with one another? How are they able to connect with resources? And I'm very encouraged when I think about March 17th, when we knew that we were going to shut our doors, my mind first went to the most vulnerable clients that we have, right, many of which have lung disease. And they're the leaders in this. They've worked with their pulmonologist, and they have learned, maybe they never touched a computer before, but with the help of friends and family, they've learned how to connect with their doctors, and that same skill set is what we're doing to connect with them. So we do everything by phone or Zoom.
Yeah, I mean, I was talking to Amanda briefly about how great this technology is allowing people who may have even left the islands to still connect with their doctors here in Hawaii because of that, ability. If we got anything out of this whole COVID thing is a new way of doing medicine and reaching out to the clientele and making sure that they're getting everything they need to keep up with, what they started out with. So this is exciting in that sense.
Right.
We can do without COVID, but, that's a different story.
Yeah, and, we don't have a crystal ball, so we don't know how long this is going to last. But what we hold first and foremost is our mission is to live God's love, inspire health, wholeness, and hope.
Yes.
And some of the key words in there, I won't break it down every single word, but it's the only mission statement I've ever been able to speak without reading it. And it's about inspiring. As you know, people have the choice. And our job is really to inspire, but each person has that choice. And that last word in that mission statement is hope. If we have hope, just about anything is possible. So we've tried to stay centered to that, to keep our clients safe, to keep our staff safe. And so Zoom is the way. So for 2021, our theme is living well through COVID.
Yeah, isn't that crazy that you have to come up with a new theme like that? But I feel like we've come so far in understanding how to be in control of this to some degree, to the point where I feel like we're starting to function back to a little bit more normalcy with hospitals and clinics and centers like yours, where people are starting to get a little bit more trusting. Even though, wearing a mask, what was it? Our future mayor, the mayor-elect, Rick was saying that, he's forgotten that he had his mask on because he was trying to drink coffee and he had his mask still on his face. And that was a little bit of a faux pas. But think about it. That reality has now become our reality.
Well, I like hearing that because I know as we adjust, you also hear people talk about COVID fatigue. And as we go towards even the first round of vaccination, I know there's been a lot of dialogue of what can you do after first round, what can you do after the second round of vaccination. And I think we have to keep in mind that it's always also about protecting the other people around us.
Yeah.
There's a lot still unknown. So I think some of the things we've been practicing for the last, let's say, 9 months, they still stand. So we can all become experts. I know there was a time when people would say, so what is your training? And I would say public health. And they looked at me like, okay, you're not a nurse, you're not a doctor, you're not med tech. What are you doing? And now it's pretty amazing that everybody has a public health hat. And I think that's a good thing.
Well, I think it's necessary. Education is key, and you don't have to be a medical doctor to keep educating the public, especially if you know what you know. It's good to share, and that's why I have this radio show. I know what I know, but I don't know everything, and that's why I like having people like you guys on, because it helps me push forward what my agenda is. It's just to get everyone empowered and educate them to the best of my ability, so that they're able to take their health into the next level where, maybe it's a better quality of life, and that's important. And I think that's what you guys do at Castle, correct?
Yes, that's we aspire to do that. I'm thankful for your show. I think we do learn from each other. There's a lot of good that can still come out of it. I think each of us is going to remember COVID, and we're going to think about what happened, what didn't happen for the rest of our lives. But what I really hope is that we don't let physical distancing deepen our loneliness. It's something that I'm not sure if it's a familiar term for you, but it's called a social recession. We're all pretty commonly familiar with an economic recession, but the social recession is something that is a little less known. Is that something you want to cover today? You tell me.
Because that affects it causes depression, anxiety, it causes all sorts of stuff in the body, which then can cause certain diseases. I think we're naturally creatures that need companionship. When you don't have someone to hug you or touch you, we need that touchy-feely. That's kind of like our love language as human beings, I think. And that causes people to feel, even more desperate, I feel like. And that's important to cover that as part of health.
You're so right. And it's something that I think people don't always realize, because the connection is connecting with ourselves, giving ourselves a break to kind of think, give ourselves time and space to take a deep breath. Some people call it meditation. Some people, it's a walk. Whatever that is, we need time for ourselves, and certainly we need time with others. And I think it can be really confusing because some people don't realize you can be among other people and still feel lonely. And there is a physical, emotional connection to that. I mean, the negative ripple effect is one where the individual is affected, the people around them, and really society. But we can choose to be a compassionate culture. So it's all about equipping, and that's something we're moving to do, is really encourage people to identify behaviors that become healthy habits and to do it with the support of others. And what I really like is meeting people in Zoom now. I'm seeing friends and family connect across the world that maybe they never did. And for people in Hawaii, it's pretty amazing where our cost of time and travel often is a barrier to connecting professionally and personally. But with Zoom, it's pretty much like if you know what the time difference is, you can hook up with the people that matter in your lives or make new friends.
Yeah, I mean, this is why I love what's come out of this whole thing is this technology and accessibility. People who didn't like doing FaceTime before now do it because that's the only way they get that interaction, right?
You're so right. And I think there's a little misnomer. Some folks think that it may be only the extroverts that need the social connection, but basically there's no discrimination no matter what level of education we have or economic means. The importance of connection is key. So I go back to Dr. Murthy and his findings looking at the opioid crisis, heart disease, diabetes. There's a strong connection to people who have stronger bonds to other people that they consider to be quality, have a 50% chance of a higher quality of life and a longer lifespan.
That's amazing. Yeah, well, I agree 100%. I mean, what are you going to say? That's the gist of it. And I know that if you, like I was saying with Amanda, if we give our body the stuff that it needs to do its job, it will do its job. And I feel like there's a disconnect in every level, whether it's emotional, mental, physical. We got to figure out a way to gap that.
Right. And just like Bianca, you're learning from others. At Castle, we are actively looking at strategic partnerships. And so this year, in 2021, we have come together with experts in art, and art as a means of creating higher levels of resilience. So the Windward Artist Guild, they're artists, and we are offering 25 art workshops in this year.
Oh, wow.
Yeah, it's really exciting. I took my first art workshop about 2 weeks ago, and it's for the person maybe who's never done any art to the person who already likes art. And when we constructed this, we said, we're going to have instructors that not only are professionals in art, but they know how to teach and encourage, and they must use supplies that you can find in your home or get at a grocery store.
Amazing.
Just make it easy is the whole point, and have some fun.
Yeah, that's the name of the game. You need to make it entertaining enough so people want to learn more. I mean, this is some of these things that we talk about here on the show may go over some people's heads because this isn't their normal language. This isn't something that they normally talk about. So I feel like when it's not even a matter of dumbing it down. It's a matter of presenting it in a different way that they can relate to it.
That's a good point. Like, how can we make wellness, healthy lifestyles relatable? And that's something we constantly try to revisit. We come up with an idea, we design it, and then we get feedback and we retool it so that it's valuable to the community resident. Right.
Yeah, it's imperative. And I think your programs are very interesting. So what other aspects of the center do you guys do? What exactly does it encompass so that people know that when they walk through the doors, this is what they're going to expect from you guys?
Oh, I'm so glad you asked, because in my 5 years at Castle, what I've learned is Once somebody gets exposed to Castle, they keep coming back for more. But it's kind of like an oyster, and then you get the pearl, but people don't even know they're looking for oysters. So what we thought is this year we're going to help out by we're doing a virtual open house, evening and daytime. We're doing this on January 21 and January 22. And it's going to premiere some of the key services that we offer, which I already mentioned, the art. We're going to talk about cooking and how to have immune-boosting meals available, how to deal with stress and stressors, so basically increase coping skills.
Nice.
How to build a resilient body through movement and fitness, whether you're somebody who's going to do chair exercise, stretch, or you want high intensity, we've got that. And then our cardiologist, Dr. Munir, is offering a healthy lifestyle class. It's called CHIP. She's a certified trainer for CHIP, and that's something we'll be doing, as well as you've already met Amanda. So she's going to talk about the importance of gut and how our guts increase resilience in our bodies. So that's a kind of a quick view of some of the things that we do. We also have, for people who want to reduce their use of smoking or vaping, we have a fully funded program, so we offer that service for free. And for mothers who want to quit, we also provide other rewards and incentives like diapers.
Oh, okay. There you go. Because let me tell you, they go through those a lot. Really quickly. Every mom I talk to, like, we can never get enough. But I think overall, though, I think this little seminar that you guys are putting together, it's going to make a difference in start of the curiosity. Like, I think someone who may not have realized that exercise was crucial, even if they're diabetic, for, their well-being. Why? Because it helps balance part of the balancing of the insulin that's being put out. I don't know if they understand the value that you guys are bringing here, but everyone, this is great. If this is free, go. I mean, register. I know you guys can register on, Amanda had mentioned it. It's vargo.com/Adventist Health Castle /classes. And, I mean, this is going to be virtual, correct?
Yep. All of our offerings are virtual.
Yep. And
our single website that will connect to registration that's maybe easy to roll off the tongue, a little easier, is AdventistHealthCastle.org/wellness. Our art classes are $10 a person, but in January they will be free. Okay. We want to make sure that there's no barrier at all.
Right.
And we accept insurance. We have all kinds of different plans so that people can receive care. That's what we feel is the reason for our being here in the community.
Well, it is a new year, and it is something that we want to encourage a healthier lifestyle, right? I mean, I always tell people, don't do a New Year's resolution. That stuff doesn't stick, but come up with goals, set goals that are small, like maybe 4 weeks goal. In 1 month, I'm going to do this. In 3 months, I'm going to do this. 6 months, I'm going to do this. So that way, these are attainable goals. And I think being educated about how to do them too helps. So I think this would be a great way for everyone to get started learning about nutrition, gut. I mean, gut health it's not a fad. It started out with functional medicine. And I know that with a lot of these functional medicine practitioners and doctors, their biggest go-to is making sure that there is enough bacterium in the intestines and to support absorption and also to support immune system. So I think this is going to be a very good education for everybody who do attend these seminars.
Yep, you're so right. Functional medicine is something that we're familiar with, but it's foreign to a lot of people. And as you talk about, New Year's resolutions often fail, but if we can break it down into smaller, measurable goals, I mean, I like to talk to people and listen to, okay, what are you fired up about? What do you want to do tomorrow? And what are you willing to do for the next? And here's the key question. Often people think that to build a habit, it's 21 days, but you probably know the answer. Should we tell the audience what the real number is?
Yeah, it's longer than that. I'm sorry.
Yeah, on average. I mean, it depends on what behavior we're looking, but on average, the science is proven to be 66 days.
Yeah, I know. Unfortunately, I had a psychologist, behavioral psychologist come on board, and I'm like, so to a key to a healthy habit is 21 days. He goes, no, Bianca, it's 60. I'm like, what? All right, fine.
Yeah.
Just a little bit more effort and a little bit more time. That's all you need to look at it, right? So.
Well, and the thing is, I found that when I share that with people, they're actually sometimes encouraged because they're not as hard on themselves. Oh, no wonder after 22 days I didn't stick with it. Maybe I needed to give myself more time. So then it gives a whole new window of opportunity to kind of think about, well, how do you adjust the context? How do you make it so that you can feel more confident to get to the 60th day? And then by 66, you don't even have to think about it. It becomes part of your lifestyle. So that's what we look for, is just little baby steps.
And that's the way of succeeding. Because I always feel like when you make these big goals, it's so overwhelming. You don't know where to start first, and then you kind of set yourself up for failure. I think you're right. And I really am excited about your guys' event that's coming up in January, because I feel like if it's done well and done right, I think you guys will be encouraging a lot of people to take the first steps to figuring out how to live a better quality of existence, because that's basically what it is. I mean, we all live in this body, and the body does malfunction, and it, for whatever reason the root cause is. But when you are able to get the right tools, you might be able to, get a better quality somewhere. It's worth it. I really believe that, because, you're talking to someone, like I was telling Amanda, I have fibromyalgia. Mm-hmm. And as we're talking here, I'm having flare-ups in different parts of my body, and that's normal for me. And sometimes it comes on strong, and sometimes it's mild. But I'm doing everything correct because I'm not on medication for this. I live by doing the right things like nutrition, enough physical activity to keep my body going, sleep, the supplementation, all those things that you need to learn. And I know this because my background is in health and wellness. And so since I'm lucky enough to have that knowledge, I'm lucky enough to sustain a quality of life. Not everybody does. And that's why your guys' center is very important. I think it's crucial. And the reason why I'm advocating people to go on, because it's a Zoom, they don't have to leave their home. It really is effortless. And the reward is going to be an education that I think is going to be important.
Yep. And, I think as you say all that, you remind me that we're all on this journey. Yep. And people are at different points of the journey. So I will say I'm not a big fan of rewards to established behavior. However, I think incentives can be a good way to attract people to a new activity.
Yep.
So with regards to our virtual open house, we are going to have some pretty awesome gifts that are health related. And, it's going to go to the people that decide to interact on Zoom. We'll have an active chat. And it'll be kind of a fun way to learn, make it really interactive, and then give people recognition and some fun. I won't reveal what the gifts are at this point. That will
you can whisper in my ear; they won't know.
Yeah, there you go. There you go. But yeah, so I think just wanting it to be a fun time. And with COVID, the other piece that we didn't know is people, as we talk about this at the start of this session, their habits are different. So we thought, okay, we're going to offer it in the evening because that might work for some people. And we're going to offer it midday at lunchtime because that may work for others.
Right. Good. That's smart. Because some people are still working out there, and there are those people who are home that may have this time to educate themselves. I mean, this is a great opportunity. I really want this new year to be successful for everyone. I really believe that if we can stay positive, try to support each other as much as we can, get yourself out there via Zoom, at least get yourself educated because you have more time to do so. And figure out what's your niche. And once you figure that out, you'll, in this new norm, I hate saying that phrase, but it is true. What can you do to be successful? Because staying at home and being depressed and feeling like you're hopeless isn't going to be the answer, because it's up to you to figure out, how am I going to get myself out of this? And then find the people that can support you. And I think you guys are one of those peoples, grammatically correct. And I think you guys are out there to support the public. And I think, I really feel like this would be a great opportunity. So definitely January 21st, 22nd. So 21st at 6:30, the 22nd is at 12:30. And definitely go to the website, which was, again, if you can give it to us.
Oh, sure. So our website is adventisthealthcastle.org/wellness. And we also are on Instagram and Facebook as Castle Wellness Hawaii. And we're going to be looking forward to, by March, April, we'll be rolling out a virtual cooking class. We used to provide them in person, and Uala Cafe, Chef Dan Swift at Windward Community College, he was one of our routine chefs that would come through our programming. So he and I are getting ready to launch this virtually.
Nice.
In the meantime, if people want it, they can get his classes that AARP is offering.
Nice.
And that has created a nice medium for people. So a lot of choices.
Well, that's the thing. I'm glad. Thank you so much, Tracie. I believe that what you're doing is meaningful. So thank you so much for coming on and sharing this with my audience. I really hope I'm going to check back with you guys. I was telling Amanda that I definitely don't want to lose contact with the both of you, because I feel like it's good to network and keep people that you know close to you so that you can always, refer and help, advise the people that you're trying to help. So definitely thank you so much. I wish you all the success, and thank you for coming on, because I know you're busy, but unfortunately, like everything else that's good, it has to end, and that's where we're at the end of the show.
No problem. Thank you,
and I wish you all the best. Have a great rest of your week, and let's look forward to 2021, right?
Sounds good. Oh, and if anyone's looking for some last-minute holiday shopping, we have gift cards available. So it's contactless. Just push it through email or text.
Hey, online shopping is the way to go.
Yep.
This is what we do.
Yep, Bianca, thank you.
Thanks, Tracie. I appreciate it. Okay, guys, you heard the news. I did my best to make sure that you guys got some information so that you start your 2021 on the right foot. And listen, I'm still around. I'm a personal trainer. I'm a nutrition coach. I'm a lifestyle coach. I'm here to make sure that everything you guys are doing is supported. I want to be there for you, so please allow me to be there for you. Contact me if you can. Go to BeFit4Health. That's the number 4, not FOR. BeFit4Health.com, and go on the contact page and reach out to me. I'll do the best I can to help you. And I know financials might be a hard thing for some of you, but we can figure something out when it comes to writing a fitness program, maybe for the 2021, or a nutrition program for 2021. And if I can't help you with nutrition because you have a specific illness, I've got people now that I can send you to. So, hey, it works out, right? All right, guys, I want to end this note with a positive. Listen, everything you do and everything you think is a reflection in your body. So make sure you stay positive. Try to look at the bright things in everything that happens in your life, because anything that's bad can only stay bad for so long. The good will come, right? So stay positive, stay healthy, help each other out, be there for each other. God bless you all, and have a great rest of your day. Aloha.